Hi there! For this video, we'll be taking up managing clients with delusions. What are delusions? These are false beliefs that are fixed in nature, meaning that no amount of arguing or debating or presenting evidence to the contrary will change the client's mind. For the client, this is reality, period. Some delusions are relatively harmless. Example, believing that one is a celebrity. However, some delusions may potentially harm the client. Example, believing that one can fly or is invincible. If a person believes that he can fly, then the possibility is he may fly out through the window. If he believes that he is invincible and others don't share the same belief, he may try to prove his invincibility by banging his head repeatedly against the wall. And both of these actions can cause harm or even potential death. Some delusions may potentially cause the client to be aggressive. Example, believing that others are a threat. It's just human nature that we want to protect ourselves from threats. That is self-preservation. So if the client believes that other people are a threat to him, then he may try to eliminate these other people. What causes delusions? In schizophrenia, there is evidence that very high levels of dopamine in the limbic system play a major role in the emergence of delusions. Therefore, antipsychotic medications are the basic tools in the management of delusions. However, this lecture will focus only on non-pharmacological interventions. So how do we manage clients with delusions? First, until you know the content of the delusion, it's important to keep yourself safe from potentially violent reactions. And how do you do this? Keep a safe distance or some barrier between you and the client. Stay a few feet away from the client or have a piece of furniture such as a table between you and the client. Position yourself so that you will have an easy access to an exit. So position yourself near the door, but do not block the door because just in case the client decides to make a run for it, your position in the door can cause you to be run over by the client. Do not whisper or laugh. Do not whisper to the client because that may interfere with the clarity of your communication. Do not whisper to anyone in the presence of the client because that may be misinterpreted as you and that other person plotting against him. Do not laugh. Laughing may be misinterpreted as you laughing at the client, and this can cause the client to get angry and he may lash out at you. Do not touch the client without permission. Touching is going to be a violation of his personal space and he may feel threatened and think that you're going to harm him. Explain your intentions before acting. Everything has to be clear before you do anything so that there will be no misinterpretation of you trying to harm him. Determine the content of the delusion. Ask questions about elements which indicate a potential for harming self or others. For example, if the client says that someone is trying to hurt him, then ask, who is trying to hurt you? If the client points to another patient, then it would be wise to relocate that patient away from that potentially violent client who has this delusion. Do not indicate that you believe in the delusion. For example, if the client says that he is Superman, then don't call him a Superman or Clark Kent. Instead, call him by his name. Validate any part of the delusion that is real. For example, the client says that Dr. X went to the nurse's station yesterday and he talked about killing the client. Then you can say, yes, I saw Dr. X in the nurse's station yesterday. He did come, but I did not hear him talking about anything related to killing you. Do not take the client's accusations personally. So even if you're included in the accusations, remember this is not real. Therefore, there is no need for you to defend yourself. Do not argue with the client that the thoughts are not real. The more you argue, the more that the client is going to insist that the thoughts are real. And he may reinforce his delusion by giving more details. He may even include you in the delusion, casting you in the role of a villain because you are a non-believer. Instead, you may say, I believe you are telling me this as you see it. So when you say this, you are not saying that you believe in the delusion, but you are simply believing that this is how the client sees the situation. Instead, focus on the client's feelings and encourage discussion of these rather than the content of the delusion. Remember, the delusion is not real, but the feelings are very real. The delusion is not modifiable because it is in the client's mind, but the feelings of the clients are modifiable. So focus on something that is real and modifiable. These are the client's feelings. Example, you can tell the client, it must be frightening for you to believe that there are people who will hurt you. You are not telling the client that there are really people who will hurt him, but you are simply recognizing his feelings. Provide solutions that will not reinforce the client's delusions. For example, what would you do if the client refused food because they believe that the food is poisoned? You may be tempted to prove to the client that the food is not poisoned by taking in some of the food in front of the client and saying, see, I ate the food. I did not die. Therefore, it's not poison. How would the client respond to this? Most likely, the client would just say, well, you know where the poison is. Therefore, you ate the part that has no poison and you left me the poisonous parts. And that will further reinforce the client's illusions. So in this case, simply provide food in sealed containers. Assure the client that they are safe and that you are not going to harm them. Remember that the fear is real even if it has no basis on reality. Therefore, it's important to assure the client that you are not going to hurt them. In addition, ask whether there is anything you can do to make the client feel more comfortable. This is going to communicate to the client that you are concerned for them, and this may encourage the client to start trusting you. Try to identify triggers to the delusion. Example, emotions. It has been identified that increased stress tend to cause delusions or may intensify delusions that are already present. Environmental factors such as TV or particular visitors may also trigger some delusions. Develop a symptom management strategy. First is avoiding triggers. For instance, if it has been identified that a particular TV show is causing the client to have delusions, then of course, it is practical not to allow the client to watch the TV show. If it is a particular visitor that is causing the delusion, then encourage the visitor to delay his next visit. Next, reality-based activities. Examples of these activities are walking, doing simple arts and crafts, playing cards, solving puzzles. All of these are reality-based because they are done and focused on the here and now. This may help the client be distracted from his delusions and help him focus on reality. Ideally, the client may do this together with another person, but if he is not comfortable in the presence of other people because of his persecutory delusions, then allow him some solitary activities but encourage him to perform part of these activities with another person whom he trusts. For example, if he likes walking, then you can allow the client to walk by himself and then later on join the client and you can talk together while walking. Next is stress management. Stress has been identified as one of the factors that may trigger or intensify delusions. For stress management, refer to the video that I have made. The link is supplied here, so you just click the link. And also, do not forget, please subscribe and like. Thank you very much.